Welcome to Nurse Converse. I'm Erica, and I'm your host this week. You may know me as Nurse Erica from social media or the Nurses Uncorked podcast, which I co-host. I'm a registered nurse and a nurse advocate. I'm excited to join Nurse.org to discuss a very important subject with you this week: workplace violence. I'm going to give you 5 reasons that you should always report any and all workplace violence assaults. And I'm going to give you 13 steps that you should take if you are ever the victim of a workplace assault. I want all of you to know that it is your right to report any and all acts of violence, regardless of the situation. And you have a right to safe working conditions. So let's get into it. The National Institute for Occupational Safety and Health defines workplace violence as an act or threat of violence that ranges from verbal abuse to physical assault to death at the workplace. According to the Bureau of Labor Statistics, healthcare workers accounted for 73% of all non-fatal workplace injuries due to violence. 73%. And the ANA says nurses are 5 times more likely to experience workplace violence than any other profession. Let that sink in. Those are some really alarming statistics. I knew violence against nurses was a problem many years ago, and let's be honest, it predates the COVID pandemic. When it happened to me, it was in a pediatric unit. Yes, you heard me right, a pediatric unit. Pediatric units are not immune. No one is immune from this. When it was me, I was cornered in a bathroom by a 17-year-old adolescent patient who was larger than most adults. I was groped inappropriately, and it was terrifying. And I think it really could have gone a whole different direction were it not, thankfully, for his grandmother who came in and interrupted him. And we were able to redirect him. But it was really scary. It's no longer isolated to ERs or psychiatric units like many people assume. In fact, recent incidents have disproportionately affected labor and delivery units and home health settings, something nearly unheard of in the past. A couple of years ago, I started a playlist on my TikTok titled Violence Against Healthcare Workers. And it already has over 70 videos in there. Many of the videos have numerous examples, and that's only a tiny fraction of what's taking place right now. I could easily report on violence against nurses every single day because it has become that prevalent. Who can forget June 1st, 2022, when there were 3 separate hospital shootings in 3 different states on the same day? I'll never forget that. There are several that stick out in my mind. One is July 2023 in Oregon, Legacy Good Samaritan Hospital, where the security guard, Bobby Smallwood, was gunned down right outside the labor and delivery unit. Another one was a psych nurse in Hawaii just a couple of months ago, stabbed to death by a patient. How about September 2023, Rhode Island? Another psych nurse so aggressively, viciously attacked that he is still recovering. Connecticut, October 2023, a home health nurse, Joyce Grayson, found dead in the basement of her patient's home. A home health nurse. This isn't even in the hospital. Washington State, December 2022, another home health nurse. The grandson of the patient shot the nurse while he was sitting in the living room with the patient. Totally unprovoked. In a Florida NICU, July 2023, the mother of a NICU patient stabbed 3 employees with a kitchen knife that she brought from home. Missouri, July 2022, in the emergency department, a triage nurse and an EMT were stabbed. New Jersey, December 2023. In a pediatric ICU, 2 nurses and a medical resident were stabbed. I could go on and on, but there was one in particular that pushed me to take action. And that was when a nurse and a medical social worker were the victims of a double homicide in the labor and delivery unit at Methodist Dallas Hospital in October of 2022. In the wake of that tragedy, my good friend Matthew and I created the Red and Black Ribbon campaign. You may have noticed healthcare workers around the country wearing different forms of a red and black ribbon. It's an awareness ribbon, and it serves a couple of purposes. First, to raise awareness of the increasing rates of healthcare worker violence. It creates opportunities to have those crucial conversations. Patients and visitors inevitably notice the ribbons and they ask. And then you can start that conversation. Did you know that there's actually an epidemic of violence against nurses and healthcare workers? It helps to educate the public that remain vastly unaware that this is even taking place. It also sends a clear message that healthcare workers will not tolerate these dangerous working conditions. It's a bit of a silent protest. Whether it is patients or visitors, they're finding ways to bring weapons of any sort and all sorts into healthcare facilities and settings. Why? Because very few places have appropriate security measures in place. It's not just guns and knives anymore. Unfortunately, they're getting creative. There have been nurses injured or worse with hammers, IV poles, hot coffee, oxygen tubing, nebulizer tubing, fire extinguishers, call light boxes, even an axe. So you see, it is pervasive throughout the healthcare industry. No specialty is safe from violence, and no healthcare setting is safe from violence. Healthcare organizations have failed to acknowledge it, to adapt, or to implement changes to protect their employees. And they're obligated to do that. One way to force employers to implement those changes is by reporting every single incident. Incidents of workplace violence remain vastly underreported. Nurses should always report every assault, and I'm going to tell you why. For one, it holds the attacker accountable. Remember, this is a crime, regardless of who did it and where it took place. Number two, it creates a tracking mechanism and a paper trail. This may prove beneficial for any, for example, workman's comp claims, legal action. These reports are discoverable in court. It helps quantify violent incidents per specific hospital or employer. It helps to identify patterns. Healthcare organizations, they don't like the negative publicity that comes from these things. And this holds them accountable to provide safe working environments. Number 4. A known risk factor for workplace violence is the perception that violence is tolerated and victims will not be able to report or press charges. By reporting, we are eliminating one of those risk factors. And last but not least, it is empowering. You may be the victim, but you don't have to stay the victim. It is, in fact, your right to report any assault, any workplace violence. Nurses are often discouraged from reporting assaults by patients. Law enforcement sometimes will even tell you that, for example, the district attorney will not prosecute any patient assaults. Whether or not the district attorney decides to charge an individual is completely beyond your control. You have no say-so in that. But it should not deter you from reporting the crime. Remember, it is your right to report acts of violence, regardless of the location and the situation. This is what nurses should do if they are assaulted at work. Now, the order might differ depending on your individual situation, and some may or may not need to take place. But in general, these are the steps you're going to want to take. Notify the charge nurse immediately that this has happened. Go to the ER for treatment. Get checked out if need be. And if you are at all unsure, err on the side of caution and go, because we all know that sometimes injuries don't really manifest until after the fact. And we've got all that adrenaline going, you know? So go to the ER. And if you need to, if you have an injury, go through workers' comp, because this is a workplace injury. Notify your manager and send a summary email if you are notifying them verbally. If the person that assaulted you is a patient, then you need to inform the provider and the social worker, and you need to document it. Notify the security department. Do not assume that somebody else is going to do that. Take it upon yourself to do it. Fill out an incident report. Even if they tell you not to, it is absolutely your right. Fill out an incident report. And then check with the security department or check with your manager. Some organizations have additional reports that you can submit that are specific to the security department or a specific workplace violence form or report. So do all of them if you have more than one option. Keep a copy. Ask any witnesses to write a statement for you. Now, this could be a visitor. It could be a coworker, anyone that witnessed any part of the assault. You want to ask them to write a short statement of what they observed for you. Take pictures of any visible injuries that you may have incurred. Continue taking daily pictures as it heals. Contact law enforcement and make a police report. I'm going to say that again. Contact law enforcement and make a police report. Now, the way you go about this is going to differ place to place, situation to situation. Sometimes law enforcement will come to where you are at work and take a statement from you. Sometimes you may need to go to the police department on your way home or the next day and file that report. And sometimes you can actually do it all online. But whatever you do, don't let it go. Make sure you file that report. And you should take time off to heal, to process what has happened. I know this isn't always practical, and it's certainly not encouraged, but we really should be doing that. Seek out trauma crisis counseling, critical incident stress debriefing, or even with your organization's EAP counselor. And keep copies of all of this at home. Don't keep it in your employee email. Keep copies at home. And any of these interactions or conversations that took place verbally, make sure you're following up. Send that summary email to create your paper trail. This holds them accountable and it helps to protect you because you never know what's going to happen down the line. Also, if you carry your own personal liability malpractice insurance, check your policy because little known fact, some of them actually have provisions for coverage of workplace violence injuries. Following any incident, the proverbial question, the meme, the one that everyone is always asked by the manager, what could you have done differently? I recommend that nurses turn the tables, that you flip the script and you ask them, what could you have done differently to protect your employees? Or how could you have provided safe working conditions? I would be remiss if I didn't mention retaliation. According to OSHA's guidelines for preventing healthcare worker violence, employers should ensure there are procedures to ensure that employees are not retaliated against for voicing concerns or reporting injuries. Retaliation of any kind is absolutely illegal. You can report that to the National Labor Relations Board and to OSHA. And the direct reporting links are on my website, nurseerica.com, with more information. But I want to reiterate, retaliation of any kind for reporting safety concerns or workplace violence or injuries is absolutely illegal. And retaliation is not strictly being terminated. Retaliation is clearly defined and it takes on many different manifestations. It could be a change in schedule, a reduction in hours, no longer being given charge nurse shifts. There's many forms of retaliation. The reason that they get away with doing these things is because, unfortunately, nurses tend to not ever report the retaliation. I'll never forget a new grad nurse who recently shared her situation with me, where she reported being physically assaulted to her manager. When her manager responded, you're not going to believe this. She had the audacity to say that she had reviewed the video footage and noted that the nurse could be seen eating a bag of chips at the nurse's station prior to the assault, and then went on to threaten the nurse with corrective action. Now, if that isn't gaslighting and retaliation, I don't know what is. So recognize it for what it is. Give it a name, give it a title. It's gaslighting and it's retaliation. And reporting any workplace violence or injuries is absolutely a protected act. So don't let them manipulate you. It wouldn't be difficult for employers to provide the basic security measures. And we should demand that they do provide safe working conditions because they are obligated to as employers. There should be, at minimum, metal detectors at every entrance, not just in the ED. And those metal detectors need to be manned, meaning there needs to be an employee there, a security guard, 24 hours a day, not just on night shift. And those metal detectors need to be high tech enough to pick up everything, not just guns, because believe it or not, there are some that only pick up guns. So all the knives and anything else can come right in and it's not typically caught. There should be armed security, in my opinion, in every healthcare setting. Did you know that there's a trend the last few years of a lot of organizations having policies that prevent their security guards from physically touching a patient? Even if the patient is actively killing someone, they are not allowed physically to intervene. It renders them essentially useless. It's absurd to me. We need to have actual security guards, and we need to have armed security. And in really high-risk areas, we should be having armed law enforcement, and not just in the EDs. We should have locked units where appropriate. And here's the caveat to that I think they get away with a lot. You need to have someone assigned whose job it is to let those people in and out, to be screening them appropriately. And that person should not be the nurse, because this is something that they do all the time. They might install a camera outside a locked unit, but there's no unit secretary, there's no clerk, there's no one there to keep an eye on it. And it's just constantly ringing. And they make the nurse do that. They put it on the nurse's plate. That needs to be assigned to someone that is not a nurse. that is not out there providing the clinical care that can sit at the desk and give it the attention that it deserves. And we should have panic buttons strategically at nurses' stations, at different locations, and individually. We have the technology to do all of this. Employers will tell you they don't want to do this because of the optics. They don't want to give the public the impression that they are not safe in the hospital. Well, the fact is they are not safe in the hospital. Healthcare workers aren't safe, and the patients certainly aren't safe at all. That's the reality. But the real reason that they don't want to do it is because they don't want to allocate the resources, meaning they don't want to spend the money. We all know they can afford it. It's simply that they don't value nurses and healthcare workers' lives enough to invest in it. It always comes back to money. We should be receiving hazard pay. Let's be honest. U.S. hospitals and healthcare settings are quickly becoming some of the most dangerous places to work. We need to take a stand. Pressure your representatives to support the appropriate legislation that will help us. For example, the Workplace Violence Prevention for Healthcare and Social Service Workers Act. It's H.R. 2663 and it's Senate Bill 1176. That would require employers to implement workplace violence prevention plans. And also the SAVE Act, which is short for the Safety from Violence for Healthcare Employees Act, which would make it a federal crime to assault hospital workers. And we should all be wearing some sort of red and black ribbon every day in solidarity to demand change. Remember, it is your right to report workplace violence. Do not let them tell you that you can't. Do not let them tell you that you shouldn't. And do not let them tell you that it's pointless. My hope is that you will feel empowered to report any and all acts of violence, and that you will now have the knowledge of what to do if you ever are a victim of this. Because the reality is, nursing is quickly becoming one of the most dangerous professions to work in. And everyone has the right to safe working conditions. I hope all of you have learned something from this, and I want you to stay safe out there. You can find me at the Nurse Erica on TikTok, Instagram, Facebook, and YouTube. And I am co-host of the Nurses Uncorked podcast, which is available everywhere that you stream podcasts. You can also find the enamel pin version of the red and black ribbon on my Etsy store at the Nurse Erica. Please continue reaching out to me with your stories of violence, and let's change things for the better. Thank you.